So lower back pain is really common and we see it all the time here in clinic. One thing I want to go through today is hamstring referred lower back pain. So if you're someone who's had back pain before or know someone who has, there's a high likelihood that it would have been accompanied by hamstring pain. This can happen for a number of reasons. Typically, it's going to be irritation of the nerve root, the sciatic nerve root in particular, that comes down the back of the leg. So it can be as a result of a disc herniation, it can be a facet joint irritation, or anything at the lower back that's just impacting that nerve, and you can get this referred pain down the hamstring. One common mistake people make is they will just address the soft tissues at the lower back and then start with some core work and not always address the symptoms lower down that can come into the hamstring. So what I'm going to show you today is typically how we would treat a hamstring in the case of lower back referred hamstring pain. So the main things we're going to be focusing on anatomically is the sciatic nerve mostly, and obviously the hamstring group. So in terms of the sciatic nerve, it exits the lumbar spine around L4, L5, S1, and it has some branches down to S3 as well in the sacrum. It comes through the gluteals, particularly underneath the piriformis most often, can sometimes go through the actual piriformis itself or over the top, and it will come down the hamstring. And now it lies slightly deeper to the long head of the biceps femoris. So if you trace it all the way down, and it will come then slightly lateral on the hamstring down to the knee, and then it will branch out. So most commonly what you'll find is people will report pins and needles, a dull ache. It can sometimes be a sharp pain or even some tingling down the hamstring. It's going to typically be slightly lateral of the hamstring and up near the proximal hamstring tendon. So the other main structure we're going to look at is obviously the hamstring group as well. So we've got the biceps femoris, which runs from the ischial tuberosity, slightly lateral down the back of the leg, and attaches to the head of the fibula. And then we've got the semimembranosus and semitendinosus as well. They attach to the medial tibial condyle and also the pes anserine tendon. In this case, what we're going to look at predominantly is the biceps femoris, just because it's close attachment and proximity to the sciatic nerve. So to start with, when it comes to treatment, I like to just get the knee slightly flexed just to take some of the stretch off the hamstrings. So we're just going to warm it up first. So nice, deep, broad strokes. Make sure we're covering everything from the distal end to the proximal hamstrings, just warming everything up nicely. And what you should find is it goes nice and red, so nice erythema. This is just obviously creating some friction, which dilates the blood vessels, allows some fresh blood flow into the area. See, the hamstring group themselves are innervated by the sciatic nerve as well. So what you're going to develop is some contractures through those muscle tissues. So as I'm coming through and warming up, just spending a bit of time through each hamstring just to feel where those contractures are, and make a bit of a note as to where I'm going to work then a little bit deeper. As you can see, it's gone nice and red. So now I'm just going to put the leg down. I'm just going to work a little bit more specifically then to that lateral hamstring. So I'm just coming in and just bowing into the lateral side of that biceps femoris, just getting a good feel of how much tone it's holding. And you can feel there in particular we've got some trigger points, contractures there. That's an area I'm going to work on. And what to remember, and this goes for any muscle tissue, is it's 3D. So what we're looking to do is to try and manipulate those tissues in as many different ways as we can, not just rubbing over the top of the tissue, but trying to get around the outsides, try and move it as much as we can, really manipulate and get it nice and pliable and moving as best we can. So now I'm just going to flex the knee again up onto my leg just to take the stretch off, and now I'm just going to get a little bit deeper and just bow through some of those tissues, particularly that biceps femoris. And as I'm working through, I'm always looking for how it's feeling underneath my hands. So is anything starting to loosen up? Is there any areas that are just a bit more resistant to the pressure that I'm giving? So now I want to just add a little bit of movement, just to try and get that hamstring lengthening and shortening as I'm treating. Just going to take the foot, just keep nice and relaxed for me. All I'm going to do is going to pick my spot and my trigger, and I'm just going to lengthen that hamstring by just extending the knee. So get my pressure on, go from flex to extended. Big trigger point there. You just need to make sure the patient's nice and relaxed. Get back in. And I'm spending a little bit of time, if I found an area where I feel like I've got a bit more contracture and some trigger points, I'm spending a bit more time there, just trying to work the tissues and trying to mobilize it as best I can. Again, thinking about that 3D structure as well. I'm going to come just lateral to the biceps. I'm going to rotate the hip as I'm pushing through. Now, the area I'm really interested in is, as I said, we've talked about the biceps femoris and the way the sciatic nerve runs just deep to that. So I'm going to come in quite high up, quite proximal here. I'm going to work quite deep. And now what I'm trying to do is I'm effectively trying to glide that nerve through the muscle tissue. So I'm going to try and get on. And it's a very small movement. I'm essentially just taking the slack out of the skin and then just trying to glide that nerve through the tissue. Now this can obviously be quite an aggressive technique. So I won't spend too long, and then I'll just come back in. Keep plenty of blood flow in the area. And now I'm going to do the same technique in terms of trying to get the knee to flex and extend, and just really try and get some length not only through the muscle tissue but through that nerve as well, and get it gliding as best we can. So to just get that sciatic nerve gliding a bit more, we're going to go from a flexed knee position again, and then we're going to just extend whilst gliding through that tissue and through that nerve. So to add a little bit more onto it, I'm going to get you into point his toes. He's going to plantar flex, and as he extends his knee, he's going to dorsiflex his foot all the way down to a straight knee. So that's just going to stress the sciatic nerve a bit more. So we're going to start there. So pointed toes, good, and then come down, dorsiflex, toes up, and again, up and down. Good. Good. And as we're going through this movement, I'm just finding that spot again, just on that biceps femoris, get nice and deep, and then I'm just going to extend the knee. Good. And one last technique I'm going to try in this prone position is I'm going to pin the tissues where I've found there's some trigger points and some adhesions there, very close to the sciatic nerve. I'm going to pin those down, and now I'm going to get Ewan himself to actively flex and extend the knee, so I can just apply a bit more pressure and really try and mobilize those tissues as much as I can. So I'll find that area again, stay nice and relaxed, and then just bend your knee. Good, and then straighten. Good, and again, bend and straighten. Good. And up, and down, and up. Good. Do two more. So just come up, I'll keep the pressure on, and as he extends his knee, I'm just gliding just over the top. Good. Now this isn't big strokes, this is just gently gliding. There, relax. Good. And you can feel already the tone in that biceps has just dropped out. It's nice and soft and nice and loose. So I've spent a bit of time there warming up. I've done some semi-specific work just to try and ease my way into the tissues, and I've done some a little bit more aggressive work into the sciatic nerve into the biceps femoris, into the triggers, just to try and get everything moving better, allowing that sciatic nerve to glide through the muscle tissue better. What you'll typically find is that now if I retested, particularly the slump test and a straight leg raise, there should be more range of movement and less symptoms. After this type of treatment, it's completely normal to feel some soreness and even get some bruising after the treatment. It will typically last 24 to 36 hours and then should subside on its own.